Hi, Dr. Spages here. First off, I want to thank you for downloading the Simple 21-Day Diet. You're really going to like it. It has a lot of good information. And one of the things that I've been seeing after working with diabetics for over 20 years is that most people don't even have a foundation for what to eat. So you'll notice that it'll actually come in your email. You'll be getting this in your email where you could start applying it right away. And you could download it and look at it and start applying it because this is the information I've been using to help so many diabetics throughout the years. Now, one of the things I've seen is that most people who are type 2 diabetic, yeah, the diet is a good starting point, but they had a lot of unanswered questions like, how did I become a diabetic in the first place? Why can't I lose weight? What's affecting my blood sugar levels? Is it genetic? So what I did was I actually created an entire course that you're really going to get a lot out of. And it's going to be detailed on this page, but I want to actually go over it with you because I really, really think it would help quite a bit with helping your type 2 diabetes like it's helped with thousands of other people I've helped. All right, so here we go. Let me explain a little bit about this course and give you more details about what's included. So whenever I put out a course, and I have quite a bit of them, my promise is this, that if you follow the diet and the instructions and the lifestyle tips I give you, you will actually see results, okay? So that is a promise that whenever I put a course together, I don't want it to be a waste of your time. I want it to actually benefit you so you can actually improve your quality of health and your life and actually see that you actually get well. All right, so let's get into what this course includes. The first thing is you're gonna be getting the 21-day diet, okay? So this is gonna be talking about protein, how much protein to take, also what is the best protein-rich foods, because remember, protein helps stabilize blood sugar, how to avoid sugars, so it actually helps with cravings. And what grains to avoid. A lot of diabetics think that there are certain grains that are good for them, but there are some that are, and there's some that are actually very problematic. So I do a whole video presentation on this so you really understand in depth exactly what to eat, especially on the 21 days. The next thing is there are foods to eat. So I put a comprehensive list together of all the foods that you should be eating. These are easily found in most grocery stores. And then also what to look for when you are buying your groceries. There are certain ingredients that are actually not great, especially as you're trying to get yourself better and improving blood sugar levels. There is also a list of foods to avoid. There are commonly 25 healthy foods, so they say, right, that you think is actually good for you, that you think is actually healthy, but it's actually not. It's actually secretly increasing your blood sugar levels, and I see this all the time. So anyway, you're going to learn about that as well. Okay, so those are the foods to avoid. The next thing is the best supplements. There are over 40,000 different supplements available out there, whether you're buying it on Amazon or at your local grocery store or CVS or some other place. But there actually are 10 vitamins and supplements that are really good for type 2 diabetics. So you're going to learn about the best multivitamins, also the best type of vitamin D. Not all vitamin D is great, right? There's a lot of bad products out there. And then also, as you know, as a diabetic, stress and diabetes are not friends. So you're going to learn about a really good stress supplement that I've recommended for years that have been really, really good for helping with your body to handle stress. Yeah, it's not going to get rid of all the issues at work or in retirement, but it will help your body adjust and adapt to it. So you'll learn all about that as well. The other thing is most diabetics have a hard time, besides the pharmaceutical medication, but also detoxifying. So you're going to learn about things that could be harming your body with toxins, and also how to eliminate them out of your environment and how to easily spot them as well. So you'll learn about that as well. All of these are actually included complimentary in this course. Okay, so you'll be able to get all of those. They all have a value of $27, but they actually come free within this course. The next thing we look at is videos that I put together training you on the very important topics, such as what causes type 2 diabetes, what's really at the root of type 2 diabetes, why don't medications work to fix those things, and a remarkable approach that I've been using for over 20 years that actually almost works like a miracle with helping blood sugar levels and seeing people lessen medication that I see every day in my office, and I've been doing that for a long time. So you're going to learn more about that. Also, what is prediabetes? Is prediabetes preventable? Why do prediabetics become diabetic in the first place? So this is a really good training that I also put together that you'll get quite a bit out of. The next thing is, what is normal blood sugar? Now, as many radio and TV interviews I've done, and all the different, I have over 2 million views on YouTube. Most diabetics don't even know what normal healthy blood sugar level is. It's kind of remarkable, and it's not your fault actually. There's a reason for this. So I'm going to actually show you exactly what is healthy blood sugar levels and how to know if you're really progressing in the right direction. Also, it's kind of crazy, right? Have you ever gone to your doctor and the doctor says, "Hey, listen, everything is good, you're healthy," and then here, refill your prescription. It's kind of crazy. You're like, if I'm so healthy, why am I refilling prescriptions, right? People who are healthy don't have a prescription issue. So anyway, you're going to learn more about that in this particular training. The next thing is exercise bad for you? Now, if you've been following me on Instagram and Facebook as well as YouTube, you're going to know that I'm kind of an advocate for not exercising as a type 2 diabetic. But there's actually a reason behind that, and you're going to learn when it's appropriate to exercise and when it isn't, why exercise is actually bad for diabetics, and then when you do exercise, which are the correct exercise to use. So you're going to learn all about that in this particular training. The next thing is, what is the best diet advice for diabetics, right? There's so many diets out there. There's keto and intermittent fasting and all these different diets. But many of them don't have long-term success. Yeah, they'll work for 3 months. Yeah, you'll lose some weight. You'll take a nice picture. But it doesn't mean that you have long-term improvement with your health and so forth. So you're going to learn about this and also how to balance your blood sugar with the diet advice you get. So this training is also included within this course. The next question most people have is, well, why do I struggle with weight? On this next training, it's actually going to go into that, right? Why are you eating healthy and still struggling with seeing your body composition changing? Maybe you're not losing the inches you'd like to, or maybe you're trying to get to a particular weight that you've been many years ago, even after a pregnancy or after you've had children. Well, I'm going to go into that and also what you need to do to actually unlock a slow metabolism. There are particular things that are real important that once you unlock it, the door opens and really starts moving in the right direction. And so forth, and also how to address the root issues under weight problems. So this is also a part of this particular course. So I put this together at a very affordable fee. I spent hours and hours putting this together and making everything for you, but I did it at such a low price that anybody could do it, and that's essentially why I did it. So if you're interested, get started today. Just click the link below, and then you'll have access to it right away. You can get started on it, and I'd love to hear your feedback. So thank you very much for watching this video, and enjoy the course. And if you need any help, we're here for you. Okay, so remember, your body is born to heal. Be well, stay well, and have a good day.